Hi everyone, it's Dr. Zach Borus from Dickinson County Board of Health and Lakes Regional Family Medicine here in Dickinson County, Iowa. It is the 4th of September. I'm going to take off my mask. Just wanted to give a quick update on where we stand in terms of COVID as we go into the Labor Day weekend. Happy Labor Day to everyone. And give a little bit of an update about what's going on here at the hospital in Dickinson County with schools open, as our clinics move next week. Lots going on. So just where we stand in terms of COVID, in terms of numbers here. There have been 436 confirmed positive cases in Dickinson County since March. 34 of those have come in the last 2 weeks. So we continue to see consistent numbers. On average, 2 to 3 a day. Some days it's 7 to 10, some days it's 1, some days it's none. But on average, we are continuing to see a steady number of positive tests. Out of the tests that are being done in Dickinson County, 7% of those as of today are positive, and that risk stratifies us into the moderate risk category for community spread. So that's on the average of the last 2 weeks, and that's, as you likely know, what schools are going by to decide whether to stay in person or go to a hybrid model or go all online. Right now, everyone locally is in person, and all of the districts are in some fashion encouraging masks of students, whether that's required or not, depends on your district. But we think that everyone has done a good job so far. We have not seen a huge spike in kids or their families who are getting COVID, but again, we've only been in school for now 2 weeks as of today. So time will tell, but we hope that those measures are adequate and are keeping numbers down. It's Labor Day weekend, and so this is sort of the last hurrah here in Okoboji for the summer, which obviously raises some concern that folks could come in from outside of town and bring with them COVID. So you've likely seen that pretty much all of the college towns in Iowa are national hotspots at this point. So Johnson County and Story County have the first and third highest positivity rates over the last couple weeks in the country. And those kids are still at college. That said, some may come home for the weekend. We know lots of folks around here who have kids who are students at the University of Iowa or UNI or Iowa State. Additionally, we're seeing high numbers of over 20% positivity in Story County of Ames, in Sioux County, where perhaps because of Dort, I'm not sure, but the numbers are high in all of those places, and we know that kids sort of converge on Okoboji for the holiday weekends. So if you are a parent of those students, please encourage them to stay in their college towns and continue to isolate. If they have come home, please encourage them to wear masks or to continue to socially distance this weekend, because I think it would be horrible if those kids came here, brought COVID back into our community in a higher level, gave it to their friends, their families, and then left. So continue to encourage responsible behavior, social distancing, wearing masks when you're out in public, and reconsidering perhaps going into crowded bars, restaurants, etc. inside for extended periods of time. So same story, different day, but please just be responsible and encourage your kids to be responsible. It has more of a ripple effect now that now that our younger kids are in school. So the recommendation and really the guideline is that if someone in a household, so say you as a parent go out to an establishment and get exposed to COVID and get it, unfortunately, if you test positive, then your kids need to be out of school for at least 2 weeks. So if there's a household contact, your kids are going to be home and potentially spread it and otherwise. But think about that before you yourself go out and potentially expose yourself this weekend. You know, COVID is here, as we know already, and this has been sort of a lull. We did great over 4th of July, it appears. People did not get it, and I hope that happens again. People did get it, but our numbers did not spike drastically locally. But definitely give it a second thought before you do anything risky this weekend. Still have fun, still go out on a boat, still socially distance, have a barbecue outside, but just be cautious. Schools thus far have been going well, and we hope that they continue to do so. The data is limited. We are through public health. We are talking with the districts regularly and are providing guidance, but there's no central data repository statewide of how many school kids have it or don't. So we're going to continue to talk with the districts and try to get some more data as we go forward. But I know that's the question on everybody's mind of how many kids have it, how many kids in each school have it. We're not privy to that information unless they share it with us. So we are working to get that info and be able to give you updates. Couple things that are exciting and that are going on here in the next 2 weeks. So the move down to the Lakes Regional Family Medicine space is happening throughout next week. So our official opening date is September 14th, so Monday. Not this Monday, but the following Monday. We are all very excited to all be under one roof and in a purpose-built clinic that will be efficient and modern and hopefully provide excellent care in a wonderful facility. Bear with us as we work out the kinks, because as with anything new, there will be kinks. So especially next week, as some of us have moved and others haven't, just call ahead and find out where you're supposed to go. But everything's looking great. Another thing that's going on here is that the Test Iowa site has now moved from the ice arena to the hospital campus. So it's off of 23rd Street in the north parking lot near where Spirit Lake Medical Center was. That has limited hours at this point. It's Monday, Wednesday, and Friday. Help me out here, Jennifer.
Monday 8 to 4. And
Monday 8 to 4.
Tuesday through Thursday 7 to 9 a.m. and 3 to 5 p.m. and Friday 7 to 9 a.m.
Wonderful. We are not open on Labor Day, so Tuesday of next week will be a full day of 8 to 4. We continue to see steady streams of folks coming in, somewhere around 40 to 50 people each day, it appears, and we're pleased. That is still free and accessible to everyone who has an Iowa address, so go to testiowa.com if you want to be tested or if you think you've been exposed. And still continue to call the respiratory clinic if you have a known exposure or if you have symptoms at 712-336-6696, and we'll get you checked out. For kids to be able to return to school after symptoms, we are strongly encouraging them to get tested, and otherwise they're supposed to quarantine for at least 14 days if they've had a symptom. So it makes sense to get them tested because you'll know within 48 hours whether it is or isn't COVID. But again, if they're seen at the respiratory clinic and they are found to have an ear infection causing their fever, then they'll get the antibiotics, get a note saying you're okay to go back to school because you have an alternate diagnosis and you're okay. So get tested if you think you have symptoms. That goes for kids too. It's freely accessible. So the only other thing that I wanted to touch on, and there's going to be lots more information, is vaccines. There's been rumblings about vaccines being approved sooner than we expected. That may be in the next couple months as per CDC communications in the last few days with state public health departments. That would likely, unless one of these phase 3 trials goes remarkably well, but they are still actively recruiting patients and participants for these trials. But it would, if they do allow it, it will likely be under emergency use authorization. They are known to be safe already because they've gone through stage 1 and stage 2 trials, but they may be available. That said, it'll be very limited supply and with uncertain effectiveness. So that's to start. Those trials will continue, but most likely, if it is released early in October, November, December, without those trials being completed, then it'll probably be going to long-term care facility residents and staff, healthcare providers, other essential workers before the general public. But we are working on our plan here locally and as a state and with Avera to really figure out how that might look. And there's so many unknowns at this point that we'll keep you as posted as we can as we know more. So we are all hopeful for rapid approval of effective vaccines that can be distributed to everyone as quickly as possible, and they will be safe when they are freely available to everyone. At the same time, we hope that they're effective too. So that's just where we are. So again, happy Labor Day. Enjoy it. Enjoy the day off. Thank you to all of our workers in all of our industries. Thank you to all of you for your patience and perseverance with this virus and with changing your habits. I think we've done a very good job here locally in terms of keeping our numbers generally low. Hopefully we do not see any more spikes after Labor Day or as we go further into the school year, but time will tell. So continue to be safe, continue to socially distance, continue to wear a mask, and take care of each other. And if you think you have symptoms, get tested, and have a wonderful weekend. Thanks for your time.